Dear colleagues, thank you for following my page, Obstetrics and Gynecology Ultrasound for All. And concerning this picture, please, when I published this picture or this case, and I mentioned that this is, of course, this is a gestational sac, but what I have mentioned in the quiz is that this is a case of secondary amenorrhea for 5 weeks, and we have BHCG tetra positive. So these are the data I have given to you. Of course, thank you all for your comments. But the teaching points in this picture, or in this case specifically, are the followings. Of course, this is a transvaginal ultrasound, and this is the urinary bladder. As we know from our basic ultrasound scans, we know that the urinary bladder is at the up left side when you are using the probe, the way we have mentioned in our basic ultrasound courses. So this is an AVF uterus, and this is the urinary bladder, and this is the gestational sac, and this is a yolk sac inside, and this is a tiny separation. As you can see, this funneling, this is a supra cervical separation of the sac, and so she may develop some spotting, vaginal bleeding. Of course, many of you had mentioned this as a fluid in Douglas pouch, or they thought that this is fluid in Douglas pouch, and that's why some of you suggested the diagnosis of heterotropic pregnancy, that there is intra and extra uterine pregnancy, or there is an ectopic pregnancy in addition to the intrauterine gestational sac. But this is again a bowel, and this is the usual problem or the usual mistake we have seen in so many reports or in comments or in assessment of many cases. Please remember how the bowel is appearing, and this is a cross section of parts of the colon, and this is a colonic part in the Douglas pouch. Thank you very much.